Hello, and welcome to the routine replacement of a low-profile balloon gastrostomy tube in pediatric patients, video for caregivers. This is brought to you by the American Society for Parenteral and Enteral Nutrition and supported by Avanos Medical. The purpose of this video is to educate caregivers about the low-profile balloon gastrostomy tube routine replacement so they can perform this task. General care of the tube and management of any complications are outside the scope of this video. Note, please be sure that you have been instructed by your provider on how to replace the tube before doing this on your own.
Hello, my name is Dr. Lauren Berman, and I'm a general pediatric surgeon from Nemours Children's Health in Wilmington, Delaware. Joining me is Kathleen Carr, a pediatric GI nurse practitioner from Boston Children's Hospital in Boston, Massachusetts. A low-profile balloon gastrostomy, or LPBG tube, is a skin-level device held in place by a water-filled retention balloon. It requires periodic replacement and upsizing in growing children. That allows for intermittent or continuous gastric access for feeding, hydration, medication administration, and venting. Caring for your child's LPBG. Check the water in the G-tube balloon periodically as directed by your provider. You might need to add water to the balloon if it's low. Ask your provider when it's okay to start doing this. You can add or remove water from the balloon to help the G-tube fit better. Always use the prescribed amount of water. There should be a dime's width between the bottom of the G-tube and the skin. Call your doctor if you're worried about how the G-tube looks or fits. New G-tube kits come from your medical supply company.
G-tube balloon check. Gather the supplies you will need. Perform hand hygiene and don clean gloves. Attach an empty slip tip syringe to the balloon port of the existing G-tube. Pull back to remove the water and deflate the balloon. Note the volume in mLs and compare this to the recommended amount. Attach a slip tip syringe filled with water to the G-tube balloon port, the amount per manufacturer recommendations. Fill the balloon with the recommended fill volume. Add or remove water from the balloon to help the G-tube fit better.
Indications for routine replacement of LPBG in children include the first scheduled replacement by your child's provider, weight gain causing the LPBG fit to become too snug, periodic replacement according to the manufacturer's recommendations, and wear or damage to the device, such as the failure of the balloon to hold water. The LPBG tract is the area between the abdomen and stomach, as seen at this arrow. With growth and weight gain, the tract becomes thicker, requiring a longer stem or centimeter length for the LPBG. Accidental misplacement of an LPBG can result in the balloon tip in the peritoneum, not the stomach, called a false tract. There are many brands of these types of feeding tubes, but the general components are similar. The components of the LPBG tube include the balloon to hold the tube in place that gets filled with water, the navy blue arrow, the stem or the shaft, also called tubing or stomal length, as seen here by the pink arrow, and the feeding port where the feedings are plugged in, green arrow. The water balloon port should not be confused with the feeding port. The tube is sized by the diameter of the tube in French size and by the length in centimeters of the stem or shaft, based on stomal length.
Before replacing your child's gastrostomy tube, there are several things that you're going to want to look at. First, you're going to evaluate for the fit of the tube. Does the tube fit too tight or too loose? Are there any fit issues when the child is in a sitting position? Next, you want to look at the stomach. Is there any evidence of a stomach infection or any granulation tissue that requires treatment? And then finally, you're going to consider the timing of gastrostomy tube replacement. Has this child just received a feeding? Now, before you replace this gastrostomy tube, you want to make sure that you've had the opportunity to gather all of your supplies. This will include the gastrostomy tube, any extension sets, a slip tip syringe for deflating and then reinflating the balloon, the ENFit syringe, a gauze pad, the insertion stylet, and some lubricant. You also want to make sure that you have some hand sanitizer and water available.
Attach an empty slip tip syringe to the balloon port of the existing G-tube. Pull back to remove the water and deflate the balloon. Remove the existing G-tube by gently pulling up the device with slow and steady pressure. Insert the new G-tube into the stoma until it is flat against the skin. Remove the insertion stylet. Attach a slip tip syringe filled with water to the G-tube balloon port. Fill the balloon to the recommended fill volume. Attach an ENFit extension set to the feeding port. And then attach an empty ENFit syringe. Pull back to draw out gastric content. This will confirm correct placement of the G-tube within the stomach. If you cannot aspirate stomach content, roll the child side to side or sit them up and gently push on the stomach. Try to get stomach content again. If unsuccessful, wait 15 to 20 minutes and try again. Do not use the G-tube if you cannot aspirate stomach content and notify the provider. Now let's see how this looks like on a child.
So now that you have replaced the gastrostomy tube, you want to try to withdraw some stomach contents. If you cannot get some stomach juices back after the G-tube change, try moving your child around. You can do this by rolling them from side to side or sitting them up and then gently pressing on the stomach. Then you want to try to get those stomach juices again. If you're unable to get some stomach juices, wait 15 to 20 minutes and give it another try. If you still do not see stomach juices, go to the emergency department to have the child's G-tube checked. If you do not get stomach juices back, make sure to contact your provider and do not use the G-tube until a provider checks it. After you have replaced the gastrostomy tube, you're going to want to check a few things. First, you're going to want to rotate the newly placed tube and observe for how easily you are able to spin the tube. You're going to look for any discomfort that occurs while rotating the tube and also to assess for any bleeding or fluid that may be leaking. You're also going to want to observe the child during the first use of their new gastrostomy tube. You're looking for fussiness or pain, any abdominal distension, or difficulty with formula or fluid administration via this new tube. So there are several situations when you should call your child's doctor, provider, or nurse. You should call if you have any questions or concerns about your child's G-tube. You should call if you do not get stomach juices in the syringe or extension tubing after the G-tube change. If the tube becomes clogged. If the skin around the G-tube is red, swollen, warm, sore, or is bleeding. If the stoma has a strange smell, or if there is pus or drainage around the G-tube. If your child has a fever of 101 degrees Fahrenheit along with any of the problems listed above. If your child throws up more than 3 times in 24 hours. If the G-tube falls out and you cannot easily replace it. If there is redness or soreness around the skin that does not get better with routine skin care and dressing change. There are several things that you are going to want to keep track of. So keep this information on your calendar, in your cell phone notes, on the replacement tube box, or any other medical paperwork or tracking system that you use. Make sure you write down the following information: the type and size of the tube, including the manufacturer lot number if at all possible, the date you inserted the new tube, the amount of water you placed into the balloon, how easy or difficult it was to change the tube, and any problems or challenges that may have occurred while you are changing your child's tube. So here are some recommended resources for caregivers. You want to be careful about using any non-verified source of patient or caregiver information. It's important that you ask your provider for verified resources from places such as a university, a large pediatric center, the manufacturer's website, or healthcare organizations such as ASPEN, NASPGHAN, or the Ole Foundation.
This educational offering was provided to you by ASPEN and supported by Avanos Medical. ASPEN wishes to thank Children's Mercy Kansas City Enteral Access Team for the patient videos.